Hello and welcome, everyone. My name is Sarah Amstein. I'm the Director of Partnership and Outreach here at the One Ohio Recovery Foundation. On behalf of our team, I want to thank you for joining us this morning, and we're thrilled to have such a strong turnout for today's Regional Grant Cycle 2 Request for Proposal webinar. We'd also love to stay connected with you beyond today's webinar. So you can follow us on our social media for the latest One Ohio related news and future events like this one. And if you have any questions throughout the webinar, please drop them in the Q&A feature. We will try to get to as many of them as we can throughout the webinar, and then we'll talk about some at the end. Any questions that we are not able to get to today, we will take them back and update the frequently asked questions section on our website. You can also email us at apply@oneohiofoundation.com any of your grant-related questions. So on the next slide, before we dive in, I want to cover a few housekeeping details. First is that this webinar is being recorded, and it will be available online at the conclusion of the session. So if you had colleagues that couldn't make it today or you have to jump off at a certain point, don't worry. This is recorded and we will post it on our website. We will also do this same exact webinar again in the new year. You can believe that, 2026. So if you have more questions as we get closer to the funding inquiry opening, feel free to join us again in January. So if you miss anything or if you want to revisit a topic at any point, you can access this recording. We also encourage your engagement. So again, if you have questions at any time, please submit them using the Q&A feature, and we will dedicate a portion at the end to get through as many as we can. So the scenarios that we cover today are for illustrative purposes only. They do not necessarily reflect a preference or a requirement. So we'll highlight just kind of some examples to help make the RFP real for folks. And please note that this is a very competitive grant process. As y'all may remember, in our first funding cycle, we received over 1,400 grant applications. And so due to the volume and the competitive nature of this grant round, the foundation staff ability to provide direct guidance to applicants is limited. So just wanted to call that out. And so that's why we're so excited that you are with us this morning, so that hopefully we can provide as much general guidance as possible to all of you. And we can learn from each other's questions that we have as we prepare our best submission possible. So on the next slide, about the One Ohio Recovery Foundation. We are a nonprofit charitable foundation created to distribute 55% of the funds that Ohio receives from the pharmaceutical industry is a consequence of its role in the national opioid epidemic. And we are fully committed to ensuring that every dollar that's allocated by the foundation is used strategically to make a substantial and lasting impact. So we have been entrusted with significant resources and are driven to find real, tangible solutions that help prevent substance use disorders and support those seeking treatment and recovery from addiction. On our next slide, we have a board of directors. We have 29 members from all over the state of Ohio. 19 of them are appointed by their regional boards. 5 are appointed by the governor, 4 by the General Assembly, and then 1 appointed by the Attorney General. So our board members make up folks from all over the state of Ohio, and experience really guides our decisions here at the foundation. So the integration of our board members, our expert panel, staff with lived experience, shared and professional experience is critical in navigating the complexities of the opioid crisis and guiding our foundation towards interventions that are both targeted and impactful. And additionally, the 19 regional boards, if we want to go to the next slide, are made up of a huge cross-section of local leaders, behavioral health experts, people with lived and shared experience from across the region. And each regional board is tasked with identifying local priorities that they will communicate in the RFP, reviewing funding inquiries that get submitted to their region, and then sending recommendations of which funding inquiries they would like to see funded up to the foundation. So that is the role of our regional boards, and this network of regional board members is very big. As I mentioned, it's over 300 people. On our next slide, the foundation will distribute 55% of the opioid litigation and settlement funds that Ohio will receive from the pharmaceutical industry. The remaining 45% goes directly to local governments and the state of Ohio. So that 45% equals 30% directly to local governments, 15% to the state. So today, and when you think about the work of the One Ohio Recovery Foundation, we are talking about that 55% that comes directly to the foundation from the settlement administrators. Next slide, please. So now that we've shared a little bit about how our organization was established and how we are structured, let's focus now on our roadmap to impact. And that is our vision, mission, and purpose that guides everything that we do. So our mission, to save lives, prevent substance misuse, promote recovery, and build resilient communities. We do that by uniting partners, advocating for change, fostering innovation, and what we're here today talking about, investing in effective strategies. And we could not fulfill our mission if not for the partnership we have with our board, our expert panel, our regions, and all of our grantees and future grantees. So thank you for being here and being a part of our mission. Our next slide is our vision. You know, we vision Ohio as a place where hope thrives, families are strong, and everyone has what they need to live with purpose and dignity. And again, we couldn't do that without our partnership with all of you. Next slide. So before we consider how we invest these funds, which we will get to, we have to first understand our why behind the foundation. Why were we created? The foundation's articles of incorporation lay out our purpose very clearly. And we have a threefold purpose. So we promote the health and safety of Ohioans, we advocate for the interests of Ohioans, and then we fund, which we are here to talk about today. Next slide. So I would now like to turn it over to the foundation's grant manager, Laura Spires, to walk us through the regional grant cycle 2.
Hello, everyone. I am very excited to be sharing the work of our second regional grant cycle staff and all of our board members, volunteers. Everyone's been working very hard, so we're really excited to present this opportunity for funding to you today. So I'm going to start by talking about the funding that is available in this opportunity. The Board of Directors approved a total of $45,780,885 for the Regional Grant Cycle 2. This amount is then allocated to each of the foundation's 19 regions, and these allocations follow the legal settlement formulas, and they include any unused funds from Cycle 1. Those got carried forward into Cycle 2. And each region may award grant funding up to the total amount that you see listed in the column Cycle 2 Regional Fund Balance. This chart can be found in the RFP. It's also really useful because it lists the specific counties. If you're not sure what region you fall into, you can consult this chart and you can see the total amount that is available for that region to award. And we know that sometimes organizations struggle with deciding what is an appropriate amount to request. So we wanted to provide a little bit of information to help with that decision. For this cycle, the minimum requested amount is $25,000. And each region had the option to set a maximum request amount. We actually only had one region which selected to do that. So if you're in Region 2, there is a $500,000 request maximum. And if you're in the other regions, you need to make sure you're looking at what they have available to fund and requesting an amount that is less than that. And for some additional context, the average award amount from Grant Cycle 1 for a 2-year project was $186,000, just to give you a general sense of what is an appropriate request to make. There is information about the grants each region funded in Cycle 1 on the region page of our website. So as a best practice, we recommend reviewing this information to give you an understanding of the types of awards that the region has funded previously. So now that we've got the money out of the way, we're going to dive into our grant process. So it is a 6-step process, and I'm going to review each step individually, but just to give an overview at the top, we start with step 1. Our applicants submit the funding inquiry. Funding inquiry is what we're calling this first stage of the applicant. Step 2, one of the 19 regional grant review committees will review your request, and then they will recommend some for funding, which will then be reviewed by the expert panel who checks for the evidence basis and ensures that there is alignment with our abatement strategies and our approved purposes. And then we move to step 4, where those who are being recommended for funding will be invited to submit a technical application. So you'll be providing more information at step 4 if you've been recommended to reach that stage. And then in step 5, our grants oversight committee will review, taking in that regional feedback and the expert panel input, and then they will make funding recommendations to our full board of directors at step 6, and they ultimately award funding. So let's dive into this process a little bit more. Step 1, the funding inquiry will open January 14th. That's when you'll actually be able to log into our grant portal and start typing, working on the application form that you'll find there. Please note that you must use the One Ohio Grant portal to submit your funding inquiry. We will not be accepting any materials by mail or by email. So just please know that if you email us a funding inquiry, it's not going to be considered for funding. You need to use the One Ohio Grant portal to submit any request materials to us. This funding opportunity is available to a wide range of organizations, including nonprofits, for-profits who are meeting a charitable purpose, and government entities. Applicants must be headquartered in Ohio and currently operating in Ohio. Out-of-state organizations may apply as a partner with an Ohio-based organization serving as the lead applicant. And we'll talk more about partnerships a little bit later. Organizations need to have been in operation for at least 2 years. So this means that you've been registered for at least 2 consecutive years as an organization with the Secretary of State. So 2 years prior to the opening of this funding inquiry would be January 2024. So you need to have been registered with the Secretary of State since that time. Our process for checking eligibility includes confirming the organization's tax status with the IRS and confirming that the organization is appropriately registered with the Ohio Attorney General and the Secretary of State. You must have a valid, verifiable, active EIN. And for government applicants, we'll additionally be checking the Ohio Auditor of State's Local Governments in Fiscal Distress list and the unauditable list. Any applicants that fail to meet any of these requirements will be disqualified and your proposal will not be considered for funding. So before you start your funding inquiry, you can quickly go to the Secretary of State and the Attorney General and you can check those places yourself and make sure that you're all up to date before you submit your funding inquiry. If you're working on a proposal with a partner organization, we do encourage collaborative grants. However, a lead organization must be identified, and that lead organization is responsible for the grant funding and ensuring that the project goals are met. And our grant agreement will only be made with the lead organization, and they are assuming all of the responsibility for the grant project. And also they're responsible for all communication with the foundation. So if you're working with partners on a proposal, they should be directing any questions or inquiries to you, and then you as that lead organization can come to the foundation. And we recommend as a best practice that internal rules and decision-making processes should be formalized with you and all of your partners in a memorandum of understanding or a similar agreement prior to submitting that funding inquiry. Make sure you know that your partners are all committed and everyone's on the same page before you submit this request for funding. So please make sure that any listed partners are aware that you are listing them in your request. We don't need to hear about organizations that you think you could potentially partner with. We want to hear about who's actually committed to the project. And please note that due to the volume of requests we anticipate receiving, we are not able to accept any letters of support. This is a regional grant cycle, so each funding inquiry is for a specific region. And the requested funds and the proposed project activities, they need to be specific to the region that you're applying for. So each funding inquiry will be reviewed separately. You can apply to multiple regions, but please just keep in mind that one region might select your project for funding and another may not. So please be prepared to be able to implement in those circumstances. Applicant organizations can submit up to 2 requests per region. An organization is defined as the EIN number. Organizations may appear as partners on additional requests. So you can submit 2 per region with your organization as the lead applicant, but you can partner on other work. So if you're part of a larger system, please be sure that you're coordinating internally on your submissions. All projects for this cycle will be funded for 24 months. Payment schedules will be established with each recipient at the time of the grant agreement, but just to give you a general sense of our payment schedules, they typically include an upfront payment followed by biannual payments, which align with reporting requirements. If you have a capital or infrastructure project, or maybe something unique about the equipment supplies you need to purchase, we will work with you on a case-by-case basis to ensure that the payment schedule supports the project. And please note that 5% of each grant award will be withheld until the grantee submits a satisfactory final report. So 5% of the grant award you don't receive until the very, very end. And we're just sharing how we do payments now so that you can keep this in mind when you're crafting your budget request. Applicants who are recommended for funding will be able to pick from one of 4 start date options. They're listed on this slide and they're also in the RFP. So invited organizations will make this selection in the technical application. One Ohio funding can only be used for expenses during your project period. So please do not expect reimbursement for any costs that may be incurred prior to the start date of your project. And we know that grantees often need a planning period before the work of a project can truly begin. So we want to set you up for success, that you can be able to complete your project within 24 months and not have to request a timeline extension. So please select the start date that ensures a full 24 months of project operations. So to give an example, if your project requires hiring new staff, we know that it often takes 2 to 3, if not 4 months to hire a new staff member. So we would hope that you could begin the work of bringing on that staff and selecting a start date that allows you to have that planning period so that on the day 1 of your project, you've got your staff hired and you're ready to begin the work of the grant. Okay, and with that, I'm going to turn it back to Sarah to talk about the funding priorities.
Awesome. Thank you, Laura. So now we'll talk about the funding priorities, which I know there's many questions already about this, including who we serve, what we fund, and how this looks in practice across our regions. So the target population for Regional Grant Cycle 2, your project or proposal that you submit, in order to be eligible for funding, your grant activities must directly serve people with a substance use disorder, including those with a co-occurring mental health condition and or people affected by a family member's substance use disorder, including those with a co-occurring mental health condition. So I want to be very clear about the target population for this grant. I know, excuse me, some of what we saw in our last funding cycle, folks cast a really wide net and were serving a wide range of people in hopes that they stumble upon some folks that have a substance use disorder. But for this round, who you serve needs to be very clearly articulated in your funding inquiry. We need to know who you're serving, how you're identifying them, and it has to be folks that all have a substance use disorder, including those with a co-occurring mental health condition. It could be programs geared towards impacted children and family members. They've been impacted by someone's substance use or co-occurring mental health disorder. And I do want to call out that this target population includes prevention, because prevention to prevent the development of a substance use disorder or co-occurring mental health condition is also allowable. So just wanted to call that out. This definitely includes prevention if the region is open to that as one of their funding priorities. So wanted to just spend a little time here, make sure this was really clear. And when you are submitting your funding inquiry, please articulate who you plan to serve and how you will identify them. Because if it is unclear to us, then it doesn't seem like you fit the target population. So again, this funding round, all activities must be to serve those with a substance use disorder, including those with co-occurring mental health condition. You can go to the next slide, please. Additionally, to be considered for funding, applicants must demonstrate that the program or services intended for funding align with the approved purposes that are detailed in the One Ohio Memorandum of Understanding. So if you can remember, we talked at the beginning of this about how these funds came from the opioid settlement and litigation. And there's legal documents that govern kind of what we can and can't use some of this money for. And we take this responsibility at the foundation very seriously to make sure that we are aligning with the approved purposes in these legal governing documents. So the MOU includes this definition of approved purposes that guides the allowable programs and services to be funded by the foundation. So what it means is that approved purposes shall mean evidence-based, forward-looking strategies, programming, and services that will be used to expand the availability of treatment, develop and promote and provide evidence-based substance use prevention, provide substance use avoidance and awareness education, decrease the oversupply of licit and illicit opioids, and support recovery from addiction. So we have these approved purposes definition that also guides what we can and can't fund. So make sure you spend some time reading those, again, to make sure that you are planning to serve the target population and proposing activities that meet all of these definitions. Next slide, please. So we took the MOU and the abatement strategies and we made the One Ohio funding priorities. So here are the 9 funding priorities that regions have the option to select from within this RFP. So these are what you will use to categorize your proposed project when you submit your funding inquiry. And we understand that your project may touch multiple strategies. So we would encourage you to just pick the main one. So pick the main one, and on the next slide, we created a document that is on the foundation's website where we include definitions for each of these funding priorities and give some examples of what may be included in them. So spend some time reviewing this document so that you are really clear kind of which bucket you best fall into. And then more specifically, if your region specified some funding priorities or areas of focus, that you are aligning with that correctly. So this is on the website. It is based on the MOU and the abatement strategies that came from all of that. So we tried to make it really simple and user-friendly for all of us to understand kind of what goes in what bucket. And again, we know not everything is super clean and falls neatly. Just do the best you can. Pick the one that most fits what you are doing And we'll do some of that work at the region and at the staff level to kind of make sure things are where they need to be. But I would also say to that, be true to the intended definition. I know some folks might try to kind of sneak in and fit where it is, but we have these definitions and the regions are expecting to see things that fit this definition. Next slide, please. So this round, each region had the option to identify funding priorities for this cycle, and they could limit whether they see funding inquiries for submissions or not. So that is kind of new this year, where a region could have limited what they're able to receive. This table is detailed on pages 10 through 13 in the RFP. So please spend time reviewing this to make sure that you submit the strongest funding inquiry possible that fits with the region's funding priorities. So we can go to the next slide. So we had 5 regions that are accepting funding inquiries in all abatement strategies that meet RFP requirements. So 5 regions open to accepting all that meet the RFP requirements. Then we had 7 regions that communicated areas of focus that they are particularly interested in seeing submissions for, but they are still open to receiving funding inquiries from all abatement strategies that meet the RFP criteria. So if you're in one of those 7 regions, I would, they're kind of telling you what they're hoping to see. So if you are, doing the work of one of those focus areas, definitely submit, but know that they are open to other ideas. And then lastly, we had 7 regions that chose to limit funding inquiry submissions to only those that meet their specific funding priorities. So for those 7 regions, and this is the box farthest on the right, when you go in to apply, you'll only be able to apply to their specific funding priority. So it's really important that if you're applying to one of those regions, you know their funding priorities really well. If you do not see your abatement strategy listed, that reflects your project or program that you're planning to submit. You're not eligible to apply for funding. So that would be for those that chose to limit. Some of these regions even went a step further and communicated a specific thing they're hoping to say. So they may have limited it to services for impacted children and families, but then they really want to have a focus on kinship care. So again, spend some time with that funding priorities chart because we want to make sure that, because we know and recognize that it takes a lot of time and work to submit grants, funding inquiries, applications. And we tried this round to really communicate to you in partnership with the regions what they're really hoping to see based on the research, data, and information about that region. So hopefully this is helpful to folks to know whether this is a good fit for the work that you do this funding round. Next slide, please. Oh, it's back to you, Laura.
Thank you, Sarah. I am going to talk a bit more about the budget and expenses and our guidelines around what is appropriate to include in your request for funding. So when thinking about what to put in your requested budget, you need to avoid supplanting. And what we mean by supplanting is an organization reducing its own funding for a project or budget item due to receiving a grant from One Ohio. Requested funds should be used to support new, expanded, or improved programs and services. So if your organization funded a budget item last year, we would expect your organization to continue funding that expense after receiving One Ohio grant funding. Now, if you had an external source of funding, like another grant, and that source has ended or is near completion, then you may use One Ohio funds in those circumstances. And for current One Ohio grantees, if you're in good standing, you are eligible to apply this cycle. If your project is near completion, if you're looking for continuation funds, or if it is a brand new unrelated initiative or project. And we do ask that our applicants pursue and exhaust any other available funding opportunity before applying to One Ohio. Program costs are those expenses which are directly related to implementing the project or program, and these are the allowable costs. You'll complete a budget form in the funding inquiry, which includes the total amount requested in each budget category and a narrative description of the expenses. And those who are invited to submit a technical application will complete a detailed budget request, which provides line item detail for each expense. Grantees may use up to 10% of their grant award to cover new or expanded administrative costs directly related to implementing the proposal. And the purpose of One Ohio funding is to establish new, expanded, improved abatement programs. And so administrative expenses should not include contributions to existing management or general organization overhead cost. So there are some examples of what allowable administrative expenses are on the slide here and in the RFP. And we would also like to add that we don't allow for indirect costs, which is another form of supplanting. And please be sure to keep in mind that if you request more than 10% in administrative cost, your funding inquiry will be disqualified from consideration. So it's really important that you're paying attention to that administrative cap. There are several unallowable costs listed in the RFP, so I won't go over them one by one, but please be sure that you've consulted this list. And please know that any request including unallowable costs will be disqualified. Some additional unallowable costs listed on this slide, and I did want to call out that costs for non-FDA approved medications or devices for the treatment of substance use disorders and co-occurring mental health conditions are not allowable. And also, please note that costs for services that can be reimbursed by health insurance are not allowable. So, if you can bill or if another funding source exists for the expense, you should exhaust those options first. If your project includes capital or infrastructure expenses, there are a few additional requirements. And some examples of what we mean by capital and infrastructure expenses, that includes building purchases or renovations, vehicle purchases, your large item infrastructure. So pardon me. To protect opioid settlement dollars from improper use, the foundation will retain a legal claim on any assets bought or improved with grant funds. And grant recipients will be asked to complete required paperwork, which could include things like UCC filings or property liens for an agreed period of time. And please note that any assets purchased or improved with grant funds cannot be sold, transferred, or disposed of without the foundation's approval. Those requesting capital and infrastructure expenses will be asked to provide additional documentation in the technical application. So these requirements are listed here and can be found in the RFP. So please be sure that you're going to be able to meet all of these requirements before you request any capital or infrastructure expenses. The deadline to submit your funding inquiry is Wednesday, February 11th at 5 p.m. We will not be accepting any late submissions, so please be sure that you are getting all of your materials submitted through the grant portal by February 11th at 5 p.m. And we would like to share some of our submission best practices with you. The number one being submit early. If you're waiting until the deadline to submit and you run into a technical issue or you have a question, it is highly unlikely that staff will be able to help you resolve that issue on the day of the deadline. In cycle one, as we mentioned, we received over 1,400 applications. So please keep in mind that if you're reaching out to One Ohio staff on the day of the deadline, it's possible that 1,000 other applicants are also reaching out to us at that exact same time. So please submit early and save yourself that day of the deadline panic. We would really like to recommend that you double check all of your work. And this might seem obvious, but it's really important. So please make sure that you have answered all of the questions, that you have not exceeded word limitations, that you haven't copy and pasted the wrong thing. This is really important if you're using an AI tool to help you craft your funding inquiry. We have had applicants copy and paste some bizarre chat GPT language to us that we know if they'd seen that, they didn't really want it to be part of the request, you know? So please read every word that you are putting into the funding inquiry form. Also, please be sure that you are double checking your budget and that your math all makes sense. Please make sure that each budget category line adds up to the total amount that you are requesting. And we do have a lot of resources available to support applicants on our grants webpage. We also have recordings of past trainings and webinars, and we do have additional future trainings coming up specifically designed for this cycle. And Sarah, I'm going to pass back to you for our review process.
Thank you, Laura. So we've now walked through the main elements of the RFP and changes to this grant cycle. So now we're going to go over the rest of the review process and what happens after you submit your funding inquiry. So on the next slide, so after you hit submit, and for example, say you applied to Region 3, that's where I live, your funding inquiry will be sent to the Region 3 Grant Review Committee. So each region identified grant reviewers who collectively form the Grant Review Committee. For some regions, the Grant Review Committee is everyone on the region board. And for other regions, the Grant Review Committee is a subset of their regional board members, or perhaps some ad hoc members that they've appointed to review grants. So the committee, however each region set that up, will review all the funding inquiries that were submitted for their region, and they will review, score, and make recommendations. The full region board will then vote on which ones they would like to send forward to the foundation as their recommendations for funding. Applicants recommended by the region board will be invited to submit that technical application. And this does not guarantee funding. And we will talk about that more here in a minute. So that's kind of how the region review process will work. They review all the funding inquiries that come in and send forward to the foundation a subset of those that they would like to be recommended to then advance to step 2, which is submitting that actual technical application. So next slide. Regional grant reviewers use the scoring rubric that is outlined in the RFP to help evaluate funding inquiries and support consistent, thoughtful review. It's important to note that the rubric is an internal decision-making tool to help facilitate the region's review and deliberation process. So scores are kept confidential. They help inform their discussions, but the scores alone do not determine funding decisions. There's a lot that goes into this. So the reviewer scores and feedback are confidential and are not shared with applicants or made public. Again, I'm sure y'all can understand and appreciate the volume of applications that we receive. So this is really just one tool that they use as they take into account all of the things that make each region unique and what they want to recommend. And so we provided the scoring rubric for you so you can see one of the tools the regions may use to help evaluate, in addition to RFP, eligibility, funding priorities, everything we've gone over. Next slide, please. So after the regions review and make their recommendations, those funding inquiries then go on to the One Ohio expert panel. And you can see all of them here on this slide. I have the honor of working with them. This is an incredibly dedicated, passionate group committed to One Ohio and ensuring that the grants that we fund are supported by evidence and aligned with our abatement strategies. So they evaluate all of the funding inquiries that come in. And organizations that are recommended by the expert panel as having been supported by evidence will then move on to step 4, which is the technical application. Turn it over to you, Laura.
Thank you. So those that get recommended to move forward in the process by the region will be invited to submit a technical application, and then those technical applications will move forward in our process. But please note that an invitation to submit the technical application does not guarantee funding. The Grants Oversight Committee will take the feedback from the regions and the expert panel, and they will make their funding recommendation to the full board of directors, who makes the ultimate award decision and approves request for funding. So at this stage 6, organizations that have not been approved by the board will receive a declination notice. And award announcements will be made after a grant agreement is fully executed by the grantee organization and One Ohio. So please note that there will be some time between the board of directors approving your request and that public announcement while we work to make sure the grant agreement is signed and we're in complete alignment on the project. So we have reached the end of the grant process. We made it to step 6. So I wanted to share the full process again so that you can see now that you have a better understanding of how this works. And please note that request will move through the review process as a region. And we will make rolling award announcements by region, and we'll announce that full region all at once. This is after step 6 when we've completed the process. If you have any questions throughout this period, please start by reviewing our website, the request for proposals, and the frequently asked questions section. It is highly likely that the answer to your question can be found at one of these places, if not all of these places. So please, if you have, please review these resources first before reaching out to us. But if you do that and you still have a question, you can email questions to apply@oneohiofoundation.com. That'll come directly to the One Ohio Recovery Foundation staff, and we will be able to get you an answer to your question. But please note that in order to maintain the integrity and fairness of this very competitive grant cycle, staff cannot provide direct guidance on project-specific questions, and our ability to respond to detailed questions is limited. And we really want to make sure that all applicants have access to the same information. So we can't give very specific answers that relate to your project. During this grant process, all official communication from One Ohio to applicants will come either via the One Ohio Grant Portal or through an official email from the foundation. And again, to maintain the integrity and fairness of the grant review process, applicants are not permitted to contact foundation board members, regional board volunteers, or expert panel members regarding funding request. Unauthorized contact with any of these individuals might lead to you getting an incorrect answer to your question. So please come directly to staff so that we can make sure you're getting accurate information. And also please note that any unauthorized contact with one of these sources may have an impact on the review and approval of your grant proposal. And as we have said, there are many resources available to applicants coming up. Right now, we're in this first one on the top left. And just as a reminder, that January 7th webinar will be a repeat of this information. So you're here today, you don't need to come January 7th, but feel free to forward that along to any colleagues that weren't able to make it. On January 21st, that webinar, the funding inquiry webinar, will go over the actual form, the grant management system. You'll get to see the questions, and we'll dive into the actual process of completing the funding inquiry form. And then on January 27th, we're doing an Impact Academy around the evidence component that's required for this cycle. And we also have many recorded previous webinars available on our website. There is one on grant implementation readiness, and we would highly recommend that you watch that recording if you weren't able to attend that session. So there's lots of resources out there for you. Please continue checking our website, and we will be updating that frequently asked questions section regularly as we get more questions. So we'll really be keeping our website the most up to date so that you have all of the best resources available to you. And that brings us to the end of our prepared materials. Again, here's where you can find us on social media and our website. And we are now prepared to answer some questions. Please keeping in mind that we cannot answer detailed project-specific questions, but if there are general questions about our grant process, we would be happy to take those.
Well, now I know one question that I've seen come in a lot and that was flagged for us was around the focus in the target population. What do we mean by substance use disorder? And that includes all substances of misuse. So it is not limited. It is not limited to just opioids. It is all substance use disorders, which would include alcohol. I saw someone ask about that. So the target population is substance use disorders, co-occurring mental health conditions. So that is one question I saw frequently asked. So I hope that that clears things up for folks. But certainly if you have, a focus area within there, go ahead and talk about that. But it is broader to all substance use disorders. And Mackenzie's gonna ask us some.
I'm just going to share a couple of them. So these are a little bit more detailed questions, but if a organization is submitting a collaborative grant, is only the lead organization required to submit their EIN, 501, 503C status, et cetera, or do all partners in the project need to submit their documentation?
That's a great question. We only need it from the lead applicant organization. So the grant will be made with one organization as the lead, and they'll be taking charge and responsible for the grant agreement and ensuring that it gets fulfilled. So One Ohio will be making a grant agreement with one organization, and they would be responsible for working with their partners. But we only would be doing that compliance and eligibility check on the lead organization.
Thank you.
And I know one question I see, I'll go ahead and mark it answer live. You can submit 2 applications to the same funding priority. The limit is just 2 applications per region, but you can submit to the same funding inquiry, or to the same funding priority if you would like. And we will be posting the question set for the funding inquiry. I know a lot of folks have questions, have been asking about that. We will post the funding inquiry question set. Stay tuned when that goes live. So we will be posting that so you can work on preparing your response. So that will be posted on the website. If you do not get our emails, please be sure to sign up and keep checking our grant page so that you can see new updates that we post.
There was also a question about the program start dates that talks about part of the work may be to train facilitators and different things, and whether or not the training should be part of the program itself start date. So I know there was a little bit of discussion about being prepared to start, but does training, can training be a part of that program?
Yeah, I think it might become a bit case by case, kind of depending on the nature of it, especially if whatever that training is, if you need to use grant funding for that training, like if you're bringing in a consultant or buying a curriculum, then in those cases, we would want that training to happen after the start date. Because remember, if you're expecting One Ohio to fund it, then it needs to be an expense that was purchased during your project window, during your project period, so after your start date. I think it is okay just to say some projects will still have a planning period after their start date. We understand that might be necessary for a variety of reasons, but we're just hoping with knowing the project start date options in advance that hopefully that will help you to kind of plan and think about, well, what can we do to get ready and what needs to happen after in the project period. So I hope that helped answer your question. I don't think it's a clear black and white answer necessarily. It kind of depends on the nature of the training that you're going to be doing.
And I know one question I saw come in a couple times was about statewide organizations. So this is a regional grant cycle. So if you are a statewide organization, you have to apply to a specific region, meet that region's funding priorities. And, you know, if I were that region, I'd want to know you're doing services or work in my region. So this is not a round that will have a big statewide, you know, where you submit one to do work all across the state. You have to apply to a region in this funding round, just like last time. So I hope that helps clarifies that. So if you are a statewide organization, you have to apply to specific regions to carry out your work.
Just looking to see if there are any more common questions that were asked. One might be helpful for others to know if an organization is the lead applicant for up to 2 applications, can they be a partner on other applications?
Yes, you can. Yes. The limit only refers to the lead organization.
And I saw some questions about primary prevention, universal prevention. Yes, if it is universal prevention, primary prevention focused on preventing, you know, the onset of substance use disorders and or co-occurring mental health, that would be allowable. So universal prevention is allowable. Great questions. A lot of great questions. We're combing through looking for ones that we haven't already covered yet. And I know there's one about prevention strategies. Does that include prevention of overdose, or is it prevention of use only? I would refer you to the funding priorities, definitions, and examples document that is on our website. If it's more focused on preventing overdose through things like harm reduction, whether that's overdose reversal medications, things like that, that would fall into the harm reduction funding priority. But if it's preventing use and it's working with young people and using a prevention curriculum, then it would fall into the prevention bucket. So it really depends on the specifics of what you're wanting to do, but check those definitions and examples to make sure that you're categorizing your project in the best way and making sure that you fit that region's funding priorities. Through, yes, there's a question in here about eligibility. So if you had been registered as a nonprofit and registered with the Secretary of State, but you lost your status or failed to maintain that good standing, we would be looking for 2 consecutive years of being registered and in good standing. So that start date, those 2 consecutive years, as Laura mentioned, would go back to January of 2024. And I know there is a number of questions in here about unallowable uses and kind of around indirect and administrative costs. You know, we could maybe go back to those slides. We include that in the RFP. So we can refer back to that, but the administrative, well, I guess Laura, I'll let you kind of recap some of that because I do see some questions in here related to that.
Okay. Sorry, what around administrative caps or the unallowable expenses in general?
Both.
Both. Okay,
Maybe go
great.
back to some of the budget slides.
Sure, yes. Let me do that. I'm like, what's the best way? I'm just going to click through a bunch of slides. Here we go.
For the
Okay, so
visual people like me, we need to see it again.
yes, understandable. So for administrative cost, we're looking for it should still be new or expanded cost, which are a direct result of the project. It's not just a 10% for anything that the organization wants. So I think that's maybe where the confusion would lie. So we're really looking for those administrative costs to be directly tied to the project activities. And then those are limited at 10% of the total amount that you are requesting. And I believe these examples are also available in the RFP, if that is helpful. And certainly all of our unallowable costs are listed in the RFP. But really, the best advice for when you're thinking about your budget is think about those costs that if the grant project wasn't happening, then the costs would disappear. The costs are only happening for your organization because you're implementing this grant project.
There was additional question about the administrative costs that says the 10% maximum allowed for administrative costs can be used only by the lead organization and not by the sub-awardees, which I think they mean like their partners.
Yes, that is absolutely correct. That admin is only for the lead organization. It's not that every partner also gets 10% admin on their request. So we would expect administrative costs that are directly tied to the project would live with that lead organization. So the 10% admin are for their increased administrative costs, and partners do not get administrative costs.
And I saw a couple related to grant writer fees. And if we go back to the previous slide, oh, one more, please. Like forward one more, slide 36.
Oh, sorry.
That's okay. An unallowable cost would be costs that were incurred prior to the grant award date. So the grant writer, their work, their cost is all before the grant date. So that is not an allowable use of funds. Lots of great questions. We're just trying to go through. I know some of them are kind of similar, so we want to make sure we're hitting the ones that are different. Oh, here's a good one. Someone asking about certification. So in the funding inquiry, you will attest that not only your organization, but the people involved in doing the work of this project are appropriately licensed, certified, accredited to do the work that you do. For example, recovery homes, that looks different from maybe what's occurring in a jail versus what's happening in a hospital or a residential treatment center. So we have you attest to that. And at any point, the foundation reserves the right to request that supporting documentation that you are in fact have all of the appropriate licensures, accreditation, certifications, etc. And we know that there's, some policy, things that change. So we didn't want to be overly prescriptive in here because that can change. You know what you need to have to do this work. And so please attest to it. And if you do not have something for some reason, or you're not sure, you will have that option to tell us about that. But that is a great question and stuff we will look for.
Sarah, would you mind explaining a little bit about if a proposal, there was a question about whether a proposal can have more than one priority?
Yes, and sorry, I went off camera. It was telling me my connection's unstable, so someone holler at me if I'm going in and out. If we know that some of your work might kind of fall into a couple different buckets, couple different funding priorities, pick the one that it most closely aligns with. So that would be my best advice. Without knowing the specifics, pick the one that it most closely aligns with, or that the majority of the work that will be falling into. I know there's some, recovery grants we've had in the past that like had a harm reduction element. They were doing some outreach, some naloxone distribution, but the majority of it was, certified peer supporters doing peer support, 5% of the work was doing some naloxone distribution. So that would be categorized as recovery support as opposed to harm reduction, just to give an example. So click the one that most closely aligns with the work that you're doing, or that is, the majority of those of the project's activities, if you kind of span a couple different funding priorities. And I know in the funding inquiry question set that we will be posting on the website here soon, we will communicate the word count in that. So and what we would recommend as a best practice from learnings from the last time, start to build out your responses in a Word document so that you can be checking the word counts. So that document will communicate word counts for you. So hopefully that will be really helpful to you as you prepare.
And I'll just add on that when, as it is a good advice to start working on that questions in that Word document, because when you get to the grant portal, it'll just be one user who has one login to submit that funding inquiry. It wouldn't be that multiple people with multiple logins could be working on the same form at once. So it's really good to collaborate with your teammates or your partners in like a Word document outside of the grant portal. And then you have that one person who's responsible for actually putting in the funding inquiry and clicking submit.
So um, if your lead organization has not been in operation for 2 years, that would, oh wait, that's actually not the question. Hang on. Oh, yeah, it is. If your lead organization has not been in operation for 2 years, they would not be eligible. So we love that folks are looking at collaborating with each other, but make sure that lead organization is eligible to apply. And I know Laura mentioned this. We are doing rolling announcements based on region. And so all of the region's grants will move together through each stage. So we can't give you an exact timeline of when your region's awards might be announced or when you may expect to hear things. It really depends on kind of how quickly things move through each of the 6 steps that we have in our grant process. But some indication, of when the earliest you might see it was in the project start date slide, which I think was July.
I think July 6th, off the top of my head. I believe
Yeah,
July is the earliest one that's listed there. And you'll
yeah.
make the selection for start date at the second step technical application. So at that stage, you should have a little bit better understanding of kind of, then oh, we're at step 4 and it's this month. So we can make a better guess about what that project start date would be. And we will look at that again at the grant agreement phase, say something has come up between the technical application and your grant agreement. If you want to adjust that project start date to a different of the 4 predetermined options, that would be allowable.
I know one of the questions was about whether or not capital expenses would include like a building lease. I don't know if that's too detailed, but
Hmm. I guess I would maybe have, I guess it might depend. If you are making improvements to a space, regardless of if it's leased or owned, if you're doing like a building renovation, we would anticipate that would be considered a capital or infrastructure expense. And with capital and infrastructure, we will be asking questions about ownership. So if you're not, as the applicant organization, going to be owning that capital asset, we will have questions about, well, who is and what's the relationship between them? If you're leasing or renting, you're going to have to explain to us why is that a better choice than the organization owning the asset. But if we're talking about just leasing a space for the work of the project, that might be a bit different.
I have another question about how, if awarded, how funds are dispersed and if they're reimbursable and what the drawdown process is.
Sure. So we would expect that most grants will have a payment schedule that they will receive an upfront payment. And then we have reporting requirements twice a year. So we would anticipate that about every 6 months, you'll report to the foundation. And if your report is approved, and if you're ready, if you have spent down your funding, then we would send that next payment. So it would be biannual payments throughout the life of the grant. We will hold 5% of the award until the end of the project period, till after you've submitted your final report and after we've reviewed that report, then you can be approved for your final 5%. And then just please know that if you have a capital cost, say you need to buy a vehicle, we can work with you to have a payment schedule where you can get enough funding for that large expense when you need it. We understand you can't buy half a car, so we'll work with you to have a payment schedule that aligns with the work of your project. But it's not necessarily reimbursable. We would give an upfront payment at the start of the project.
Yeah, I know there was a question that came in about, actually, Laura, I think it's on the next slide if you want to advance one. Non-FDA approved medications. Again, going back to our target population, who these funds are meant to serve, our approved purposes definition. So we cannot fund things that are not FDA approved devices or medications. If you are doing something around pain, and limiting opioid prescribing and pain, and the medication is FDA approved, that would fit, assuming it checks all of the other boxes, not knowing the details of it. But anything with medications, they need to be FDA approved for their intended use as it relates to our grants. So I hope that answered your question. And a lot of stuff in here still kind of around prevention, like, yes, that can include youth-based prevention. It could include older adult prevention, universal. Again, preventing the onset of use. So we know that obviously there's, young people might not already be using and have a substance use disorder, but we want to prevent it. So all of that is considered part of our target population and would be allowable. And there's another question about, documentation that folks may need to submit. We'll have more details on kind of the specific requirements you may need to submit, what you attest to when we launch the question set. But again, at any time, if the foundation has questions about an organization, its eligibility, whether it's in good standing or not, we will reach out and request them. Okay, just looking through, trying to get them. If you applied in cycle 1 but did not receive funding, you can again apply this round, assuming you're eligible, meet the region's funding priorities, all of those things. And if, this person asked if, this round, it doesn't work out again, would that mean you're no longer eligible to apply in the future? And I would say that's not something we have determined. Like if you didn't get it the first or second time, you're out for good. I would probably say that is not a stance that we would take. Definitely keep submitting for our future funding rounds. And hopefully, fingers crossed, something will materialize for you. But I wouldn't read into that as meaning you're no longer eligible to apply just from not being funded previously. So
And I
keep
would
coming
just
to webinars like this, our trainings, to really strengthen your work. So great question, and glad you're here with us today. So
Yes. And I just wanted to add that, if you applied and weren't funded in cycle 1, just please keep in mind the extreme volume of requests that we received. It's not a reflection on your work or on the application you submitted last time. We received over 1,400 requests and we were only able to fund 245 of them. So just keep in mind the vast majority of applicants don't necessarily make it due to, the funding constraints and the regional priorities. And I'd also just mention this is our second funding cycle. It has a unique RFP with unique funding priorities and guidelines. And I would anticipate that that will continue to be true for all of our future cycles. We're not saying just because it's in this RFP, that's not necessarily going to be forever. It's just we can only give you the information on the cycle 2 RFP.
and someone asked if, some of this Q&A from the chat will be saved. So this is all being recorded, including this Q&A portion. So this will be posted on the website along with the slides from today. And we are capturing the Q&As that are coming in. You guys are asking great questions. And so we will do some work to kind of categorize them and post responses on our website. So again, broken record here, but please keep checking the website as we kind of start to see themes and questions folks are asking. We will post them on the website so that folks have clarity about different things. And so all of this will be posted and made available for you. Go ahead, Mackenzie. I think I saw you.
Yes, I was just going to see that we had a couple of questions about, and I lost it, of course. Just a couple of questions about the evidence guide, when that will be available, the kind of information that will be in the evidence guide, and whether you wanted to kind of clarify that at all.
Oh, that's a great question. Thank you for asking about the evidence guide. The expert panel has been working very hard on it. The requirement that our grants are supported by evidence is still just as strong this round as last time. And so to help applicants, we have created an evidence guide to supporting your funding inquiry submission that will be going live here soon. That will walk you through the evidence related questions in the funding inquiry, because we are doing things a little bit different this time. So I don't want to reveal too much just yet about what that might look like. Got to keep you coming back for future webinars about the funding inquiry and when we publish our funding inquiry question set. But we got a lot of great feedback and did a lot of reflection. So we made some changes to that. There's some different options depending on whether kind of where folks fall with what they're doing and the strength of evidence that supports it. So that guide should be really helpful to you as you kind of find where you best fit and the questions that you will need to answer. And it even includes examples of really strong responses to the questions and ones that are weaker. So we really tried to make this as user-friendly and helpful as possible. So stay tuned for the launch of the evidence guide for applicants. And please, you can go ahead and sign up now for that Impact Academy, where we will be walking through that. I see a question about a page limit. So while there is not a page limit, because again, you're submitting in our grant portal, email submissions, hard copy in the mail submissions will not be considered. So there's not a page limit because you're submitting in our grant portal and it's like preset. It's a form you fill out. There will be word limits, and we will detail all of those in the question set that we will post on the website, and they will be communicated in the grant portal as well.
Sarah, there was a question about someone who's providing prevention services to youth and older adults and whether or not those would have to be two separate applications or that might be able to be included as one with a couple of targets.
Oh, that's a good question. Using Laura's words from earlier, I would say it depends. I think look at what region you're planning to apply for. If they communicated something that was more youth specific, I might break them apart. But if not, and it's kind of open and you get better economies of scale by kind of combining the work, we love seeing, folks be good stewards of these funds and leverage staff for kind of the same program. So it may actually be kind of a better deal, so to speak, to combine that work if it's kind of the same staff rather than splitting them. So I think it depends based on your region. And then I would just make sure you're very clear in your funding inquiry, your responses, kind of what goes to what, projects, programs you're doing with youth, what you might be doing for older adults, the specific evidence-based curriculums for each. And so I think once you see the questions too, that might help you determine whether it's better to combine or separate them out as well. So great question. The registration link for all of the webinars that we have mentioned today is live on our website and was in the email that went out kind of announcing the grant round and things like that. So I will try to drop that in here as well so that folks can register. Laura, Mackenzie, y'all seeing anything else we haven't covered? I know we've got a couple minutes left.
How about this one, Sarah? Someone asked a clarifying question about applying for funds in other regions. If an organization is based in one region but does not have recovery as an eligible service, can the organization apply to another region that does, even if the services will be provided in Region 5? So I don't know if you understand the question.
The question are the services for which the services that are part of the project should be in the region that you are applying to. The region will only be funding work that takes place inside its region. If you're headquartered in a different region, but you have, say you're headquartered in Region 1, but you do services in Region 4, then you can apply to Region 4 for those services. But if the services take place in Region 1, don't apply to Region 4.
Yeah, you can certainly apply to any region. But if I'm that region and the work you'd be doing isn't in my region, that probably wouldn't be one that I would score very high. It's a good question. But that's how I would look at it if I was on a regional board. Okay. Well, we got through a lot. This was great. We appreciate so many of you being here. I know at one point I saw over 500 folks. Again, we will send out, this recording will be available. The slides will be posted. We'll be updating our FAQ. Please continue to read through the request for proposal and all of the information that we have on our grants page on our website. I know we dropped that in our responses to the Q&A. There's a lot of great information there. We appreciate y'all's patience as we receive a high volume of questions, as you just saw, and emails related to this, so we will do our best to get through as many of them as we can. But definitely, just to call back what we mentioned earlier, start by reading our website, start by reading through the RFP and the frequently asked questions that is up there so that you can get as timely of response as possible. Because we do put a lot on there and take pride in trying to overshare some stuff for you, since we know that there's a lot of you and not a lot of us. And we want you to be able to get as much information as you can as quickly as possible. So just thank you again for being here. We are so excited for Regional Grant Cycle 2. Be on the lookout for a lot more from us. We hope everyone has a great holiday season, and we will see you perhaps at our next webinar. So take care, everyone. Thank you.